The most important step in clinical waste management is option A segregation, option B transportation, option C storage, option D labeling. The correct answer is option A segregation. Steps in the management of biomedical waste. First step is segregation. Separation of healthcare waste according to their category and labeling waste containers is the most important step to reduce the risk and amount of hazardous waste. Second step is collection. Third step is storage. Fourth step is transportation. Fifth step is treatment. Sixth step is disposal. In autoclaving, the water temperature can be raised to much higher degree by option A adding chemicals, option B using filtered water, option C by increasing pressure, option D all of the above. The correct answer is option C increasing pressure. Autoclave sterilization work by use heat to kill microorganisms such as bacteria and spores. The heat is delivered by pressurized steam. Pressurization allows the steam to reach high temperatures that are required for sterilization. Most common temperature for autoclave sterilization is 121 degree, but nowadays many autoclave allow cycles at higher temperature such as 132 degree to 134 degree Celsius. Pressure used in autoclave machine is 15 pound to achieve temperature 121 degrees Celsius for 30 to 60 minutes. The single most effective means for preventing healthcare associated infection is option A periodic fumigation, option B prophylactic antibiotic, option C use of personal protective equipment, option D hand hygiene. The correct answer is option D hand hygiene. The recommended initial monophasic energy dose for cardioversion of ventricular fibrillation. Option A 360 joule, option B 200 joule, option C 150 joule, option D 100 joule. The correct answer is option A 360 joule. The preferred position in which a patient with increased intracranial pressure to be placed is option A supine position, option B Trendelenburg position, option C lithotomy position, option D head tilted to 30 degree. The correct answer is option D head tilted to 30 degree. The nurse is assessing the adaptation of the patient to change in the functional status after a stroke. The nurse determines that patient is adapting most successfully if the patient is option A get angry with family members if they interrupt a task, option B experiences bouts of depression and irritability, option C has difficulty with using modified feeding utensils, option D consistently use adapting equipments in dressing self. The correct answer is option D consistently uses adaptive equipment in dressing self. A nurse has received the patient assignment for the day. Which among the following patient should the nurse assess first? Option A patient who has a nasogastric tube attached to intermittent suction. Option B the patient who has to receive subcutaneous insulin before breakfast. Option C the patient who is 2 days postoperative and is complaining of incisional pain. Option D the patient who has a blood glucose level of 50 mg per dilution and complains of blurred vision. The correct answer is option D the patient who has a blood glucose level of 50 mg per dilution and complains of blurred vision. Signs and symptoms of hypoglycemia is excessive sweating, excessive hunger, fatigue, dizziness, nausea and vomiting, dryness of lips, mental confusion or unresponsiveness, anxiety, blurred vision, headache, irritability, pallor, palpitations, slurred speech and tremor. The nurse is teaching a patient who has iron deficiency anemia about food she should include in her diet. The nurse determines that the patient understands the dietary modification if she selects which of the following menu. Option A nuts, option B milk, option C boiled rice, option D dark green leafy vegetables. The correct answer is option D dark green leafy vegetables. MRI study is prescribed for a patient with suspected brain tumor. The nurse implements which action to prepare the patient for this test? Option A IV mannitol for 6 hours before the procedure. Option B shave the groin for insertion of femoral catheter. Option C removes all metal containing objects from the patient. Option D instruct the patient in inhalation technique for the administration of radioisotope. The correct answer is option C remove all metal containing objects from the patient. A patient has experienced acute pulmonary embolism. The nurse assesses for which symptom is most commonly reported. Option A hot flushed feeling. Option B sudden chills and fever. Option C chest pain that occurs suddenly. Option D headache. The correct answer is option C chest pain that occurs suddenly. Pulmonary embolism is a condition in which one or more arteries in the lungs become blocked by a blood clot. Pulmonary embolism is caused by clots travel from the legs or rarely other parts of the body. Signs and symptoms of pulmonary embolism are chest pain, dyspnea, hemoptysis, syncope, cardiopulmonary arrest, palpitation, chest tightness, tachypnea, tachycardia, hypotension, fever, phlebitis, diaphoresis, and cyanosis.